On the phone with me right now, Dr. Joe Congini. He is a sports medicine doctor at Akron Children's Hospital. Good morning, Dr. Joe.
Hey, Gene. How you been?
I've been very well, thank you. I understand you're going to talk to us about why when kids break their arms and legs, etc., it's different. You treat them differently than you would adults.
Yeah, you're right. That is what I wanted to mention today, and I don't know why. Sometimes these things just hit me, Gene. I walked through our office yesterday. We have the orthopedist next door and sports medicine right next to each other, physical therapy on the other side. We have a very large waiting room, and I walked into the waiting room, and I saw all these kids with casts out there. And it's the time of year that we're really busy, and it's the time of year we're busy with a lot of fractures. And it's just really good to see, with what we went through in the last several years. And I just say, oh, my gosh, we are not only at pre-COVID levels, I think we're beyond pre-COVID levels of how busy we are with sports this fall. So it really hit me that there were so many kids with fractures. And a lot of people don't realize that kids' bones, and when we're talking kids, we're talking from grade school, junior high school, still in high school, by college and beyond, over 21 or 25, different kinds of fractures. But younger kids get different kinds of fractures. And because the bone is more elastic or kind of bendable, there's one kind of fracture called a buckle fracture. It's kind of like if you crush a pop can in your hand, and it kind of the hard part of the bone will bend, but it will not break through all the way. But it's a fracture called a buckle fracture. Another one is where the bone bends quite a bit and deforms. It's called a green stick fracture. It's kind of like a young sapling tree that you bend, but it won't break. But it bends and deforms. And there's growth plate fractures are probably the most concerning because you can get growth arrests or problems if they fracture through a growth plate while they're still growing. And then kids are more prone to get stress fractures too. So for all of those reasons, those are fractures that are pretty unique in the pediatric population. And the complications we're trying to avoid, Gene, are number one, if these aren't treated properly, they cannot heal. We call it non-union. And if they don't heal, they may need surgery to be stabilized. Or another big fancy word, malunion, means they heal crooked. Or they're not in the proper alignment. And that can be a big deal in a finger, an arm, a leg, whatever. Growth arrests, as I mentioned earlier, or contractures. They get really stiff. So that's why we use casting a lot. It really reduces the pain, first of all. The first week or two, these are very painful. Secondly, it really reduces all the complications. But, of course, in our world, what kids want to know is, can they play with a cast? And you do see kids out playing soccer, football, with a cast to protect their fracture. Now, the problem is not every fracture can be able to play. Some are more complex. They may even need surgery, or they're more likely to become unstable, and we say, no, they can't play in a fracture. Our orthopedists are great at knowing the difference between what would be a stabilized fracture and what would not. But you will see many kids with some of these pediatric fractures, like buckle fractures, playing in a cast. So that's kind of a little bit of a quick 101 course on pediatric fractures this morning.
Okay, excellent. Dr. Joe, it's been a pleasure. Thank you for being on with us this morning. We look forward to hearing from you again, same time, same place next week on 93.5 1590 WAKR.